Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers. Today, a new report on misinformation and disinformation from the National Academies of Science, Engineering, and Medicine. Professor Vish Viswanath is the Lee Kum-Kee Professor of Health Communication at the Harvard T.H. Chan School of Public Health. He also served as chair of a blue ribbon panel examining misinformation about science. He speaks to Dr. Josh Sharfstein about the challenges of misinformation and distrust and what can be done to counter them. Let's listen.
Professor Vish Viswanath, thank you so much for joining me today on Public Health on Call to talk about misinformation, which is the subject of a major report that you participated in at the National Academies. How are you doing today?
Good morning. Thank you. I'm doing well. Thank you for having me, Josh.
So let's start with a question that seems so simple, but when you start digging into it, maybe not so simple. What is misinformation?
Sure. So there's a lot of synonyms that are being used for misinformation: false information, wrong information, inaccurate information. The way the committee defined misinformation about science is that any claim that is contrary or different from, that asserts something different from the current scientific evidence. So it's important to note that point, current scientific evidence. So these are claims that are departing from the current scientific evidence.
And that implies that if the evidence changes, something that might have been misinformation might no longer be misinformation.
That is absolutely correct. So which claims are considered misinformation will evolve over time as the science itself evolves.
Does that make it hard to spot what's misinformation?
I think that is the reason the committee felt we should talk about misinformation and define it at a particular point in time. It could, I think, the spotting of it is more difficult when it is unsettled science or a fast evolving science. But when it comes to more settled science, I think misinformation is much easier to spot.
That helps. If something is very clear and accepted, something that is totally doubting that might be considered misinformation. On the other hand, if people are really debating it, it's hard to say.
If I am allowed, I can give a couple of examples which also provide the nuance about science. So you take breast cancer screening guidelines, and we have some standard recommendations from the scientific authorities, CDC, Guide to Preventive Services, that every woman at certain age should start getting screened periodically with a certain, and that is a standard recommendation. And that has changed over time. But that change is every 5 years, every 10 years, or even every 15 years. So the science is settled, but it is slowly evolving. And as the science and the consensus emerges, then there is a change in that recommendation. The contrast to that is a COVID example, where the science changed rapidly because it was new information. A lot of work was going on, and the findings and conclusions were emerging. Knowledge about it was emerging almost every day. And so that, in that context, what is misinformation or not is somewhat more difficult, I think. So that's what we mean by settled versus unsettled science, evolving science.
Got it. Talk to me about the word disinformation and what that means.
Our committee felt that disinformation is a subcategory of misinformation. And the reason we said we called it that way is because so it is circulated by agents who are aware that the science information they are circulating is false. That is clear. So it's intentional. But the intentions become obfuscated as the information cascades through different networks, right? Then it becomes very difficult to know, is it misinformation, is it disinformation, because it is coming through a variety of networks. Also, the impact is similar to misinformation. So we felt that disinformation, while it is false information, knowingly circulating false information, at the end of the day, it is still a subcategory of misinformation.
So where does disinformation, let's start there, where does it actually come from?
Sure. So if you think about disinformation, intentionally, it is spread by both the individual actors as well as institutions. And some of it is, for example, I can say governments, politicians, right, could potentially mislead for a variety of reasons, right? So they can do that because of their own agenda or agendas about science. I think, that's one place. For-profit corporations and even non-profit organizations can also seed and amplify, either for financial gain or advance ideological goals or mitigate potential losses. For example, tobacco industry has done that. Fossil fuel industry is another example of that. And individuals can also do it. They can knowingly share false information because either to profit or to accrue social rewards, monetization is another motivation, or even erode trust in institutions.
So eroding trust in institutions is a popular topic to talk about these days. What is the role of misinformation and disinformation in eroding trust?
Absolutely. So we think the committee found that one of the most critical impacts at a societal level is that erosion in trust. It can happen by questioning evidence, by attributing motives, by saying that more work is needed. And so there are a varieties of ways where you're questioning the motivations of people, of the agencies, of the institutions that could potentially lead to the erosion of trust. Also, while that is deliberate, it could be also unintended, right? Continuous evolution of science and knowledge could also say, well, the scientists can't make up their mind, even though scientists are science communicators are also adhering to evolving science, as I said, so that could potentially also contribute to erosion of trust. But also, Josh, individual experiences with institutions could also potentially do that, right? So if I'm discriminated day to day, if I am for a variety of reasons, whether it's racism or other reasons, then also I think I question trust in the institutions. So it could be. Yes.
Yeah, it sounds like you're saying that in some cases, it's clear there's an intentional effort to provide false information and perhaps intentionally to lower trust. In other cases, that may be a consequence, but it may be a consequence of people legitimately sharing information or speaking up in a way that they think is really important and nonetheless having some consequences.
So this is an important point, Josh, you're raising. Actually, this is one of the important insights we gleaned, and it has a lot of nuance. So it's absolutely correct. There are times when groups can deliberately sow information that is contrary to facts and evidence of science with the intention of casting doubts around institutions and that subject. That's absolutely right. And you're also correct that unintentionally it could lead to exposure to misinformation, where people are trying to, with good intentions, trying to inform what they know, but that happens to be false. And so what that leads to is to understand that people are getting exposed to, they're just looking for information, right? They're not looking for misinformation. That looking or seeking could potentially expose them to all kinds of information, misinformation, or disinformation.
Well, it partly makes you think that there's some element of what you're defining as misinformation that may be unavoidable because it is necessary for people to be able to say what's on their minds?
Let me reword it in a slightly different way, I think. I agree that it is unavoidable to face getting exposed to misinformation because if you take it from an individual perspective, I want to know what is the latest, say, diabetes. And if I have the resources, I go to the NIH website, CDC website, WebMD, and others, or I just do a casual search because I'm looking for that and I'm exposed to it, I think. But I may or may not know that what I found in a search is reliable, right? So that point is important. What I am exposed to could be very reliable or unreliable information, but I won't know that. All I'm doing is looking for information.
Right. So if we are going to be exposed to misinformation, if some of it is unintentional and some of it may yet turn out to be true in the future, you don't know for sure. What can be done to improve our information environment now?
Yeah. So the question then is, why do people look for information, and what can we do to make sure that they're exposed to the right information than wrong information, right? Or inaccurate misinformation. So the committee found there are 4 intervention points, actually, where you could potentially intervene and address this issue, right? And also the points are, one thing you could do is increase the supply of the correct information, right? So part of the problem, which you just alluded to before this question, is people are looking for information, they're exposed to misinformation. And so the idea here is to make sure they're exposed to it because they can't find the right information easily. So the idea is to increase the supply of right information, right? By providing funding and resources to all kinds of institutions, whether it's newsrooms or etc. The other thing we can also do under supply is reduce misinformation and disinformation, right? If there are known actors, you can deplatform them, you can decredential them, you can do content moderation. The other way to act is addressing the demand for information, right? So you have to increase, we talked about trust earlier, increase trust in credible sources of science information, or filling those information voids. That's what the committee called, right? The information voids. That there are these information voids that people are looking for information and they can't get it. So why don't we do something to fill that void? Promote science and health and digital media literacy is another way to do that. You can also intervene at the distribution level, right? You can increase friction for spread of false information, or you can increase accuracy nudges, content labeling, or demoting content that one considers misinformation. And lastly, there are well-tested interventions at the uptake level, right? At the individual level, pre-bunking or debunking after they are exposed to it, labeling, etc. The good news is there are multiple ways of addressing misinformation about science.
I have one last question. Sometimes you read in the paper that people are accusing each other of misinformation, and it almost becomes like a name-calling contest. How do we avoid that scenario where misinformation kind of loses its meaning, the term, because people are wielding it as a weapon?
So it's difficult to generalize it for a non-science context, provide an answer or response to that, I think. So certainly the term has been weaponized. The committee did not look into it, so this is more my view rather than committee's view on it. I think where the rhetoric, right? It's a rhetorical tool. Weaponization is a rhetorical tool, right? So, oh, Josh, that is misinformation. How can you say that, But I think for that day-to-day in-person interactions or even electronic interactions, there's not a lot we can do. I think that's a part of the public debate, marketplace of ideas notion where you are correcting and there's self-correction, I think. But in the realm of science, this may sound like a cop-out, Josh, but in the realm of science, we could say, okay, well, we have some facts. There is an accepted consensus. There's a consensus on these facts. Let's check against that. I think we are much more on a more secure ground when it comes to science, but not when it comes to politics.
Professor, thank you so much for joining me. That'll be the last word, an interesting last word for this podcast, but it's great to have you.
Josh, thank you so much for having me. I appreciate it.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.